Okay, we have another information update with our Hearts Against Heroin campaign is also going very strong with Conemaugh Health System, Somerset Hospital, and the Cambria County Drug Coalition. We've got some special guests today. Let me make sure I get these right, gals, rather. Lynn Mirigian. Is that... wait, what was it?
Mirigian.
Mirigian. That wasn't close enough.
Well, you had the start and the end.
And I'm usually awesome at that. Okay. And you are the TAC project director. Now tell me what that exactly means.
Yeah, absolutely. So I oversee the Technical Assistance Center that's based out of the University of Pittsburgh. We work across the state to help counties to reduce overdoses through county coalitions. And then we also have a website, overdosefreepa.org, where you can find resources. I direct that as well.
Okay, great. And then Laken, Ethun?
Yes.
And you're the lead research specialist. Now tell me exactly what that is.
Yes, so I work with counties across the state. As a group, we have 36, and I work specifically in Cambria County and a lot of the counties in western Pennsylvania.
So you guys kind of collate the coalitions, in so to speak.
Absolutely. So we use evidence-based practices from other county coalitions that have been effective, combined with a model developed by Jan Pringle, who's at the University of Pittsburgh, to make sure that all coalitions are effective in bridging public safety and public health.
I gotcha. Okay. Now, how are you connected then with Cambria County Coalition?
Yes, so Rana reached out to us in December.
Rana is the director?
Executive director of the Cambria County Drug Coalition, correct? And she had asked us for some help and assistance in reviewing the strategic plan that they developed. So we started there, and now we're working with them on implementation and then moving through evaluation and then being able to sustain their efforts as a group.
Now, as we look at a lot, since the epidemics become more of an epidemic these days, we look at it and we hear a lot about the coalitions. How do you think, how do they work, and how effective do you think they really are? I mean, a lot of us lay people, we hear coalition and we're wondering what exactly you feel that works, and you guys are the ones that have everything together, so to speak. So
yeah, so our model is actually based off of another program in North Carolina called Project Lazarus, and they mobilized a coalition, implemented multiple strategies to reach multiple facets of people and areas, and they were actually able to reduce the number of deaths down there. So that is what our program is based off of. We really hit on bridging public health and public safety specifically for this epidemic, because it's just very important to get everybody at the table and all stakeholders involved, and making sure that coalitions are very action oriented, not having meetings just to have meetings,
right,
but moving forward and getting things done. So that's the way that the coalitions that we work with are run, and that's how we view them moving forward and being able to make an impact.
Now, when you talk about the original one in North Carolina, do you have any statistics on how much life has been saved from that? What a good impact it did have
on the effectiveness? I would have to get back to you on. I don't want to misquote anything, but they were able to show
it was pretty substantial.
It was substantial. I mean, that model is used across the country now, and the big thing that they were able to demonstrate is that everyone has a touch to the heroin and opioid use epidemic, and everyone's experience is slightly different, and what they could bring to the table can be much better used rather than working on their own. And so that's why coalitions are so important, is to bring everyone together and address the opioid overdose epidemic. But I can get you some stats.
And that's fine. I'm just curious, but it was something that was definitely noticeable a great deal. So.
Yeah, it was. And I mean, to benefit Cambria, like, they just received some money from PCCD to implement programs that they had based off of their strategic plan, and that wouldn't have happened without this coalition all working together. So the coalition is definitely benefiting Cambria County.
Oh, great. And right here now, what will you do? You two obviously are with the Pittsburgh side of things, but you're implementing here in Cambria County. So do you talk with our coalition like on a regular basis? How does that work?
Yeah, so I speak with Rana probably on a weekly basis at this point, and then multiple times via email. But it's really just about providing support. The coalition does all of the work.
Right.
We don't do a lot of it. We're here to provide support to them in any way that they need. So
and kind of following through with what you've seen work already. So
absolutely, yeah. So we are experts on implementation and evaluation. So that's where we come in and helping them to think through how the program's going to work in the county, and then making any changes that may be needed.
Well, great, guys. We appreciate all your efforts. We all have been this top of mind, obviously, for all of us, and you guys live it every day. So we appreciate all your wealth of knowledge. Thanks for stopping in from Pittsburgh.
Yeah. Thank you very much for having us.
Was there anything else that you would like to add to it that we're skipping that you might need to pass along? It's just, but I mean, mainly it's people turn to the coalition. You have any questions, and that's
absolutely. The Cambria County Drug Coalition is a really good resource for the residents of Cambria County to learn about what's going on in their community, and to be able to, if they want to help, to maybe be able to work through that. So
just so listeners know, this wasn't just something that was, not thought through and put together. That's what we're showing you, that this has all been thought through. We have people helping implement examples, so on and so forth. So thanks again. Appreciate it, guys. It's another Hearts Against Heroin update with Conemaugh Health System and Somerset Hospital, along with Spangler Subaru and Martin Baker America.